Closer look at a common but often misunderstood medical condition, talking hernias here. From early warning signs to treatment options and recovery, we are breaking down what you need to know. Plus, we have details on a Q&A webinar that is going to be providing answers to the questions that maybe you've just been a little afraid to ask. Joining us today is Dr. Artem Dyatlov, board-certified general surgeon at the Harvard Healthcare Digestive Health Institute. Doctor, thank you for your time.
Thank you. Thank you for having me.
Of course. Let's start with the easiest question here. We've heard of hernias, but I don't know if everyone really knows what a hernia is.
Patients with hernias frequently experience a bulge or a lump at the abdominal wall. It may be located at the midline, in the groin, at the site of prior surgical incision, or at the flanks on both sides.
All right.
Often, the patients don't even feel it, not necessarily, but they may see it. As the problem does progress, it may become more visible and prominent. It may be associated with pain or just discomfort. That may be aggravated by a certain physical activity, depending on the type of hernia.
So we just talked about some of the symptoms or maybe the bulge that you may see, not necessarily feel, but let's talk about the different types of hernias and really what risk factors contribute to developing them.
Hernias can be divided into different types depending on their location. They can be initial or recurrent, acquired, or congenital. The type of hernia defines the best treatment strategy and surgical approach. Variety of medical conditions may contribute to development of hernias. Genetic predisposition is an important risk factor. Frequently, they may run in families. Lifestyle may play a crucial role in the development of hernia as well.
And what do you mean by lifestyle exactly? Like our diet, our exercise levels?
Hernias, physical activity, smoking, something like that.
Okay. And let's talk more about treatment options. I think sometimes if people even know they have a hernia, they're worried about the treatment option and how it's going to be handled, and of course the pain that may go along with it. So what are the treatment options and what does the typical recovery process look like?
So the only definitive treatment option is repair of the hernia. Hernias do not heal up, they do not disappear spontaneously. There are different surgical approaches, such as traditional so-called open repair, laparoscopic, or robotic. Each of them has their pros and cons, and I do believe each hernia has to be discussed on individual basis. Having said that, I should mention not all the hernias require surgery. Some of them can be washed safely, but if someone decides to proceed with surgery, after surgery for relatively short period of time, there will be some restrictions of physical activity, and the soreness after surgery will get better and better day by day.
All right, well, that's encouraging news. And I'm sure a lot of people watching, wish that they could climb through the television and ask you a question themselves regarding hernias. Maybe they are suffering themselves. So you guys actually have an upcoming Q&A webinar where participants can ask more questions and learn more. Can you give us those details, Doctor?
That's right. Next week on Wednesday at 5:30 p.m. Eastern Time, we will have a great opportunity to discuss all aforementioned and many other related topics. Join us for the webinar next Wednesday, and we will have interesting discussion.
Wonderful. And we know that registration is open and also required. And for more information, you can also visit hartfordhealthcare.org/events. Doctor, thank you so much for the information and for your time this morning.
Thank you.